I'm sure you'll be fine.
Louisa,
Hello, Martin.
I know that you heard about my job in London.
No, you might have told me first. I do have a right to know. I am carrying your child. Congratulations. It's a boy. It's a boy. It's a boy. Oh. Oh, yes. Oh.
That's all perfect, Miss Gladwin. There's no reason why you can't take baby home.
Martin's got to be in London.
Oh dear, that is a shame. Well, we'll organise something, shall we?
Yes, thank you.
I'll drive you. I've got a bit of time. If you like.
Yeah, that'd be good.
We're looking for Louisa Glasser. She had a baby about an hour ago.
I wonder if you should come to London. Now there's a baby.
There was always going to be a baby there, wasn't there? I mean, I was pregnant.
Yes, but it's different now that it's here.
Is it, Martin?
Gotcha!
Yes.
You can run, but you can't hide.
Hello, Joe.
Little boy here. Fantastic. Who's the daddy?
Oh, that's really kind, Joe, but I'm going to hold him, actually.
Then you'll be a lawbreaker. Nope, she's just the accomplice. It's a driver commits a felony. Nick of time, mate.
Terry?
It's my dad's name, my grandpa's middle name. But I'm not sure he looks like a Terry. What do you think?
Is it a bit, common? I mean, too many Terrys already. So what about London?
I don't start work again for 6 weeks. So once you got yourself settled in, perhaps we could come for a holiday.
It's not Portugal.
No.
I mean, don't you feel that now he's actually here, that it would be a bit inappropriate to go back to work so soon?
You are.
I mean, they'd manage without you. They'd manage if you died.
Crikey. You only moved out this morning.
Put him to bed, I should think, wouldn't you?
He hasn't got a bed.
Why not?
It's a flat pack. I haven't put it together yet. He can sleep with me.
Best not.
Who?
You might roll on him.
I don't think I would. Just, here. Just jiggle him. Jiggle him up and down a bit. Yeah. Infants are twice as likely to suffer a sleep-related fatality in a crib as those who co-sleep in bed with their parents or parent.
Is it American?
They have babies in America.
I think he wants you. What are you doing?
I think he's hungry.
Right. Where's the bed thing, the cot?
In my room, behind the curtains.
Right.
Really good at that.
It's not difficult if you concentrate.
I'm impressed. We're impressed, aren't we?
Louisa!
Oh, that's half the village.
Hello, Doc.
Hello, Doc.
Yes.
Congratulations! Well done, Louisa. Change your mind then, Doc. Well, welcome back.
Louisa was caught unawares, and I'm doing the best I can.
So you stopping then, Doc?
No.
Don't say you're going to London, Louisa.
What? Oh, I don't know. It'll be term time before you know it.
Bit of a puzzler there then, eh, Doc? She wants to be here, you want to be there?
What's none of your business?
Right, everybody, let's give him some space, eh? Hey, show's over.
Louisa?
Can I stay? Just for tonight. It's a long journey and it's getting late.
Oh, yes, of course.
If there's room, that is.
Sure he can manage.
Nappy cream. 3 more minutes. Nappy cream.
Oh, he's so tiny.
It's upsetting, I know, but he needs you to teach him. This is where it all starts.
No, I'm sorry, Martin. If somebody cries, you give him a cuddle.
I'm warning you, Louisa, if you cuddle that baby, it's the thin end of the wedge.
You settling in all right?
Thank you. Oh, it's lovely.
Joseph Penhale, police officer.
Dr. Dibbs. Doctor. Obviously, I'm a doctor.
We weren't expecting a woman,
No.
but welcome to the district.
Oh, thank you. You carry on. Thank you.
Are you familiar with the work of the ISER,
The what?
the Institute of Social and Economic Research?
Not really, no.
Oh, yes, apparently they've proven that the children of mothers who go back to work early develop more slowly emotionally and perform less well in reading and maths tests than the children of mothers who stay at home.
That's one view, yeah. But not everyone agrees.
Oh?
I read something that said the opposite.
Really? Where?
I forget. professor.
American?
No, actually, I don't believe she was. Thank you.
Morning, Louisa. Oh, you still here, Doc?
No, he's off this morning.
Oh, look what I got.
What is that for us?
Certainly is.
That is so kind, Bert.
It's just a loan, mind. Used to be Al's. Mine before. What?
Oh, it's very traditional.
Yeah, yeah. Look.
Do you want to come in, say hello?
Cup of tea would be lovely.
Right, now go to the chemist.
Hey, Doc! Are you going for breast or bottle?
What?
Your boy must have cried half the night. Could it be colic, do you think?
Does this one come in a gel?
You came back.
It's just a visit. You stock these items?
For your baby.
Yes. And some paracetamol, 500 milligrams.
Are you sure, Dr. Ellingham?
It's for me.
Oh.
Dr. Ellingham, the outgoing GP?
Yes.
I'm your successor, Dr. Dibbs.
Call me Di.
Yes.
So do you have any advice?
What sort of advice?
Do's and don'ts for the new girl on the block.
Don't use either of those. Your acne is beyond topical treatment. You need a subdermal corticosteroid.
Do you think so?
Yes.
I'll get some in.
Oh, thank you.
Will you be staying long?
No.
Doc, have you got a minute?
What for?
Baby supplies.
Right, don't move. Can you hear me?
Yeah, I'm all right. It's my own fault.
Don't move. Any numbness? Can you feel your legs?
Yeah, thank you, Doc. They feel fine.
You cut your head, but your skull seems intact. Does it hurt anywhere else?
No, I don't think so. Blooming lucky, yeah?
What's the prognosis, Doc?
You're probably going to be fine. Hold this. Keep pressing for about 15 minutes until the blood stops. Frontoparietal impact following a fall, superficial laceration, no obvious sign of a skull fracture, and no injury to the cervical spine. Still some pupil dilation there.
Oh, what's his name? Oh, hello, sir. I'm Dr. Dibbs. I'm your new doctor. Now, where does it hurt?
Oh, my head, I suppose, but I'm all right.
Doc!
Oh.
I got this problem I'd like to discuss with you.
Medical problem?
Yeah. Well, it's a bit awkward, really. This morning...
She's your doctor now.
First, as we put them on, Al used to fill them up.
What are you doing?
I'm just having a lesson to make sure we're doing it right.
Did you get the ones without chlorine? You want the ones without chlorine for sensitive skin. Oh, dear, don't worry. Just check next time.
Is that blood?
Oh, yes, somebody fell off a ladder.
Oh, dear.
Short, fat, asthmatic, late 50s, fisherman probably.
My chum.
Right, chap. Is he all right?
Yes, the new GP's got it in hand.
What's she like, the new GP?
She's a woman.
Oh.
Fluoxetine.
What?
Is it insulin?
Oh, these are the new doctors.
How come?
Can I help you? Surgery doesn't open till tomorrow.
Where's the doctor?
Is it urgent?
She's got my bag. You've got my bag. This is yours.
Really? Oh, I'm so sorry. Oh, they must have got mixed up in the kerfuffle. Oh, I'll just get...
Are you the old doctor? Di said you'd met this morning. Gavin Dibbs, the husband.
What are you doing with the patient notes?
Gavin's having a look at your filing system.
The receptionist understands it. I wouldn't tinker with it if I was you.
Pauline?
Yes.
Pauline's gone.
No, she hasn't.
Well, she has, actually. Gavin's going to be my receptionist.
Practice manager, whatever.
So you saw my prescriptions, then?
Yes.
The fluoxetine is only for emergencies.
And the Zolpidem?
She needs sleep. Poor lamb.
Uppers and downers. You should make your mind up. But you're the doctor. If that head trauma doesn't make an appointment, you should look him out. Mrs. Tishel will know how to find him.
So, where are you going?
Why?
Just thought we might go together. Thing is, we have a history, you and me. We go back. And though I'm sure this new doctor woman's very good, I'd rather get you if I can. I was looking it up on the computer, my complaint, and they said it could be a number of things.
Yes?
How can I put this? I'm not one for feeling myself, but... Official police business. PC Joseph Penhale, 3021. Yep. Montrevathan Street. Port Wen. I was just speaking to him, actually.
Now, have you got everything, Doc?
Yes.
Right. I'll be off. What? I suppose this is goodbye then, Doc.
Yes.
So where is the new doctor? Surgery.
Yes.
Must have been weird being there, but you're not in charge.
I don't think she's quite got a grip on it.
Well, no one's going to fill your shoes, are they? No Pauline on the kind of shape.
Pauline's gone. They've got a new receptionist, the doctor's husband. I know, it all seems a bit amateur to me.
My goodness. Hello, Joe.
Come in then.
You all right, Joe?
I am, yes.
What's that?
There's been a bit of an accident.
What sort of accident? Where?
At Bodmin Moor. A road traffic accident. Well, a single vehicle, so not really an accident as such, more a isolated fatality, you might say.
Oh, dear. Someone from the village.
It's your Auntie Joan. Really sorry, Dr. Ellingham.
When?
Yesterday. Paramedics said it was a heart attack. She was just sitting there in her truck in a gorse bush, not a mark on her. They've been trying to contact the next of kin, but couldn't, and you're next on the list. And no disrespect. PC Penhale, 3021. Yeah, I just told him. Yeah. Understood. They need a formal identification at the mortuary. I could run you over if you like. No, run you over. I could drive you there if you were feeling wobbly, which wouldn't be surprising. I mean, I'd be feeling wobbly and I've had training.
Thank you, Joe. We'll call you if need be. I'm so sorry, Martin.
71. It's not a bad age.
Well, Doctor, I do believe we are ready to start work.
Yes.
Oh, dear. Are we having an attack of the glums?
No, I'm fine.
I'm so proud of you, Diana. It really is unfair, the diabetes as well as everything else, but we soldier on, eh? Hello.
Doctor said to come and have my dressing changed. Fell off a ladder?
Oh, yes, of course. Is it you? May I know your name?
Mike Chubb.
Mr. Chubb, how nice to see you again.
I'll just get your notes for you, Mr. Chubb.
I hope you'll forgive the mess. We're not really open until tomorrow.
Very good of you to see me.
Oh, not at all, not at all. It's a bit higher than we'd like, Mr. Chubb.
Yes, I got pills for it.
I wonder whether we shouldn't up the dosage. You don't happen to know what you're on by any chance?
Perindopril, 4 milligrams. But I don't like them.
Why is that?
They give me a tickly cough.
Oh dear.
Is that serious?
No, but I could give you something else, if you like, that won't give you the cough.
Oh, Mrs. Tishel closes Wednesday afternoons.
Oh, it's not urgent. Tomorrow will be fine.
Tomorrow?
Tell you what, you can have some of mine, and then I can give you the prescription for tomorrow.
Oh, it's really kind of you, Doctor.
Did you see her?
Yes. Where are you going?
Just down to the shops for a few bits and pieces. Are you okay?
Yes, I'm fine. Is this thing clean?
Gave it a wipe down. Are you sure you're all right?
Oh, look at that. Brand new little family.
It's disgusting. She only had the child to catch the babble.
No, she didn't. What a nasty thing to say. Good afternoon.
Hello. Oh, I'm sorry for your loss, Dr. Ellingham.
Yeah, what a shock.
No, not really, no. Heart failure is the biggest cause of death in Britain.
Yeah, but just like that, going about her business.
There's often no warning, particularly if you eat too much and don't exercise.
Recipe for disaster.
Still. And she never got to see the baby, did she? Little boy, yeah? Oh, he's gorgeous.
Isn't he?
Got a name yet?
No.
No? Now, who does he take after?
Well, Bert says he looks like Martin.
What a beautiful child.
My sympathies, Dr. Allingham.
Yes.
Thank you, Mike. How's your head?
Oh, all right. New doctor's keeping an eye on me. Lovely woman. Got a pair of lungs on him, honey.
Afraid so. Did he get you up?
I wasn't sleeping very deeply. Pollen count's high.
How are you doing, Louisa? Apart from Joan, of course.
Yeah, great. Bit knackered, maybe.
It's like being mugged, isn't it, first few weeks? Well, months, really.
Yeah?
Yeah. You're sore.
A little bit.
Where?
It's nothing.
Where are you sore?
Where do you think?
No, I mean, is it just the perineum?
The what?
The perineum, between the anus and the vagina.
Martin, we're in a shop.
Well, let's get you home. I'll have a look.
No, thank you.
Where's the romance, Dr. Alling?
You could see the new woman. Surgery opens tomorrow.
Good. Yeah, thank you, everybody.
I think we should do it now.
They're not open yet. Martin, tomorrow will be absolutely fine.
Come on. Won't take 5 minutes.
There you go.
I thought I'd try without the tranquilizer.
Oh,
See how I do on my own.
well, that's the spirit.
Somehow it seems like cheating.
Hello?
Oh, it's the doctor.
No, Di, you're the doctor. Are you sure?
Hello?
Can I help you?
Is the doctor here?
So sorry to barge in. We could come back later.
Hello.
Hello. Hi, I'm Louisa Glasson.
Non-hospital birth yesterday, 2 weeks preterm, complains of perineal pain, and she wants to see a woman doctor.
I'm sure it's nothing. I'm just a bit sore.
Gavin Dibbs, practice manager. I'm sure the doctor will be pleased to take a peek for you.
Yes, of course.
Go through.
That's very kind of you.
Not at all.
So, you're still here then, eh? Got yourself a promotion, Di says. London surgeon, yes. Oh, that's nice. It's interesting work. Though this is frontline, I'd say. General practice, the sharp end, as it were. Are you married, Martin?
No.
Oh, yeah. Thought as much. Must be hard, that, in your trade. Di says she couldn't manage on her own. Yes, it's been a long and winding road, but she only finished training last month. Late bloomer.
She's got to be 50.
Oh, well, she's her own worst enemy when it comes to exams and that. She's highly strung. I mean, always puts her heart and soul into the task in hand, but then along comes a test and that little voice starts up in her head, nag, 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 and whoosh, she just forgets it all.
Everything all right?
Could you give us a moment, please?
What have you found?
Well, there's nothing jumping out at me.
Are you managing? Is there anything you want to ask?
She's a doctor, Martin. I'm sure she's got everything in hand.
Difficult to let go, yes?
Has she been failing exams for 30 years?
Oh, good Lord, no. Oh, no, she was happy enough as a nurse for the longest time, but, well, then we met, and, well, I saw at once what was going on. She'd settled for second best. Didn't even know she wanted to be a doctor. So we set to work, and it has been my privilege to see her through. A few hiccups along the way, but we got there in the end.
Everything all right? Any tears or lesions?
Everything looks lovely.
Oh, thank you. I feel better already.
Another satisfied customer.
So sorry for the fuss.
Not at all. It's better safe than sorry, eh, Dr. Ellingham? Dr. Ellingham, what's your view on metformin use in type 2 diabetes? It's just that Di's been feeling a couple of degrees under for a while now, haven't you, love? And we were wondering if the metformin is out of balance with her insulin injections.
Are you monitoring regularly?
Oh,
Yes, yes.
But her glucose is all over the place, isn't it, Di?
Well, it's not really.
We reckon it's anxiety. It'll probably pass after she's been here for a week or two, eh?
Have you had any medical training?
Me? No, total layman. But I read the trades and you pick things up, don't you?
No. How many medications are you taking altogether?
Where to start?
A few, then.
She's got a lot of ailments. Poor woman.
Related or discrete?
Pardon?
Are they derived from a common cause, or are they separate? Shall I examine you?
Examine me.
Yes, you don't seem on top of things.
Oh,
Sorry.
She's likely more au fait with current thinking than you are, Dr. Ellingham, having qualified more recently.
Be quiet. You're probably over-medicating. Would you like me to examine you?
I'm all right, thank you.
It's your funeral. Come on.
Thank you so much for putting our minds at rest.
Look, he's just a great big snob, love. You're 10 times the doctor he ever was.
Well, I can come up for specific days if need be. Yes? All right, speak then. Yes? Goodbye.
How's that?
They've waived the formal induction and Corbett's agreed to take my list for a week so I can stay here until the funeral. Or go to a hotel or something.
No, here's good. While things get sorted. Sorry. No, that's really, really good.
Now that you're not pregnant, you could eat a bit less. You're still his nutritional provider, so you'll have to be careful, of course. Normal rules apply. Fruit, vegetables and so forth. You'll need some vitamin supplement, but I'll get those from Mrs. Tishel. It's never too early to get a grip on bad habits formed during pregnancy. Breastfeeding will help use up fat stores. Louisa. Louisa.
Well, Doctor, our first official patients are here. Shall I let them in?
Surgery is open. Well, you're a little bit bigger than ideal, I'm afraid.
Yeah, I know. I just can't seem to shift it. It's like climbing a mountain.
I know. So, what do you think? Renew the anti-inflammatories, maintain the hypertension medication, step up the diabetes medication, and give you something to make you feel a little more cheerful, perhaps.
Oh, thank you. Oh, hello, Joe. What's she like? Absolutely lovely. Nothing's too much trouble.
You're next, Constable.
What you in for, Joe?
Joseph Penhale.
Hello.
Hello? thing is, I've got a lump on my scrotum, and I looked it up, and they said it could be a number of things, but it could be, you know, it could be it. It could be fatal, and I should get it looked at. I'm sorry, but you're my doctor now, and there we are.
A lump. Well, it's probably nothing to worry about. It's probably just a cyst or hydrocele. Nothing to worry about.
No? Don't you want to have a look at it?
Right. Take off your things. Never liked this bit.
Are you going to have to touch it?
Worse for me than for you.
I'll have a think about it. Come back another time, yeah? Thanks, Doc.
Get out.
Doc! Doc! Quick! Medical emergency. Please, Doc. Just a quick look.
Go and see your doctor.
She didn't want to see it. And I gotta know, is it a benign hydrocele, or is it a cyst, or is it, you know,
On your testes.
my danglers?
Is it a bit tender?
A little bit. Give us a minute, Nigel.
It is a cyst, but you should have it scanned anyway to make sure.
Thanks, Doc.
Martin? Martin?
Could you confirm the first line of your address, please, Mrs. Bollard?
12 Tremaine Road.
And have you had this medication before?
No.
No, and why is that, Mrs. Bollard?
Don't know, Dr. Ellingham.
Yes, you do. You've already damaged your liver, and until you get your alcohol consumption under control, diclofenac will make it worse.
The new doctor said I could have some for my ankles.
Well, she's wrong. Put it back. What's yours for? This won't do you the slightest bit of good. We've been through all this.
Yeah, but I got a second opinion.
Did you? What's yours for? Come on. What's that? What's it for?
Prescription.
What?
It's a toilet matter.
Go through. Have you got your inhaler? Where's your inhaler? Oh, God. Yes, right. Where's your inhaler? Where did he get these from?
I don't know, Dr. Ellingham. Certainly not from my shop.
I've been using it a lot.
Mrs. Tishel?
It's all right, Mike. Ambulance is on its way.
He doesn't need an ambulance, he needs an inhaler. How many of these have you taken?
I don't know. A few.
Where did you get them from? They can be lethal to asthmatics.
Dr. Tippett gave them to me.
Right. Out of the way.
That's right, yeah. It's going.
And if it hasn't gone in a couple of days, try doubling the dosage.
Mr. Trifford.
Could you just give me a moment, Gavin?
Morning, Doc.
Yes. I need to see the doctor.
Ah, well,
She's not a busy at the moment.
I don't care. I need to see her.
Well, may I ask why?
No, you may not. I just need to see your wife. Is there a problem with that?
Well, if you could be a little more precise in your inquiry, I'd be very grateful.
She has been handing out beta blockers to an asthmatic. That's why.
Well, is that a problem?
She could have killed him.
Well, there's some sort of misunderstanding. Please, let's not be hasty. Please, give her a chance. She's a wonderful doctor.
She's a terrible doctor. Let go.
Dr. Dibbs, open the door. Open this door. Open this door. I need to speak to you.
Hello, Mike. Have you seen Martin at all?
Yeah, he got up to surgery, see the new doctor.
Oh, with the baby, yeah?
No, Joe Penhale took him.
What?
Dr. Dibbs, will you please open this door?
If I may.
Di? It's me, love. Precious? Are you all right?
Dr. Dibbs,
Oh, leave me alone.
have a seat. For God's sake, woman, you're going to collapse. Told you.
Diana? Diana! Speak to me, my love.
Get her bag. Her doctor's bag. Get it. Dr. Dibbs, what medication are you taking? What medication are you taking at the moment? What's she on? Fluoxetine, Zolpidem, metformin and insulin, right?
Yes.
Anything else?
Beta blockers for her blood pressure, statins for her cholesterol, tetracycline and
Isotretinoin. For acne, yes?
It's for her acne, relaxafine for her osteoporosis, and sometimes alprazolam instead of Zolpidem, just to help her sleep, poor lamb.
Okay. Well, we're just taking your blood pressure, love.
What happened?
Doc Martin chased her.
Call an ambulance.
Roger that.
Joe? Joe? Happened. Oh, no.
Hello? It's me again. 021. No, another one.
Oh, for goodness.
Outside the surgery this time.
What is it?
Yes.
What do you think that is?
Well, it's your stretch marks, love.
It's Cushing's syndrome.
We're on top of it.
Well, what's Cushing's?
Yep, doctor's on the scene. Well, two of them, actually. One's a patient.
Not content with mistreating her patient, she's been misdiagnosing herself as well.
Well, what's Cushing's?
Cushing's syndrome. It presents as multiple diseases when in fact it's only one. Excess cortisone. It can be fatal. A proper doctor would have spotted it.
Could you tell me your ETA? I'll relay that information.
It's all right, love. He's cured you.
No, I haven't. I've just restored her blood pressure. She's going to need surgery.
You need surgery, love. It's all right, my love. It's all right. Gavin's here. Your Gavin's here.
That was quick.
Did you cancel the one you called for the fisherman?
All right.
Thank you.
Going up. There we go.
Thank you
Don't worry
very
about this.
Thank you.
I'm coming with
Take it easy, Doc. Good luck.
Don't worry, Mr. Dibbs. What a shame. Such a nice woman.
Thanks, Joe, for looking after the baby.
Yes. Good.
We should take him home. He must be hungry.
Yes, I do. Clear path. Thank you.
Doctor, can you take a look at this? It's gone swollen and my hand's gone tingly.
Can you make a fist?
Not really. Is it serious?
Not yet.
You'd better come inside. I'll take a look at it.
Sit here. I'll just feed him while you're busy.
Mr. Hubble.
Hello.
I'm Ruth, Martin's aunt.
My condolences, sir, at this difficult time.
You're late.
Joan would be pleased. Well, if she wasn't dead, yes.
A good percentage of the people in this church are clinically obese.